My name is Luis Alvarez. I'm a geriatric fellow from SUNY Downstate Health Science University, and today I'll be presenting COVID-19 and effect on older adults. Okay, let's start with the definition and structure of COVID-19. The objectives will be to describe coronaviruses, to define COVID-19 and SARS-CoV-2, describes most modes of transmission, identify procedures that are high risk for virus transmission. Coronaviruses. So they are named after the crown-like spikes on their surface as seen on this image. So there are 4 subgroupings of coronaviruses, the alpha, beta, gamma, and delta. But the most important coronaviruses are the human coronaviruses, which are the 7 that infect people. They were first identified in the mid-1960s, and the most common and known are the MERS-CoV-2, which is the Middle East Respiratory Syndrome, or MERS, the SARS-CoV-2, which is the Severe Acute Respiratory Syndrome, or SARS, and the SARS-CoV-2, which is the novel coronavirus, COVID-19, and coronavirus disease 2019, which is the most important in today's talk. Let's talk about the transmission of the COVID-19. So the CDC guidelines have studied this disease, and they have get to the conclusion that it's a person-to-person respiratory droplet transmission. It is transmitted through sneezing, coughing, and talking, or from droplets on objects, surfaces, and person-to-person contact. Current data does not support long-range aerosol transmission of SARS-CoV-2 as is seen in measles and tuberculosis. Certain procedures in healthcare facilities can also generate fine aerosols and should be avoided whenever possible. That's why endoscopies, nebulizers, and bronchoscopies at the beginning of the pandemic were canceled, and all of the procedures that were ambulatory were also canceled, and just emergency procedures were the ones being done in the hospital to prevent the transmission during the peak of the pandemic. Here is a picture that illustrates what we can do to prevent transmission. Stay at least 6 feet, about 2 arm lengths from other people, cover your nose when sneezing, wear masks, disinfect places, wash your hands frequently.